According to Nora Volko, the director of the National Institute on Drug Abuse at the National Institute of Health, and Maureen Boyle, the Chief Quality and Science Officer at the American Society of Addiction Medicine from the American Journal of Psychiatry, on April 25, 2018, more than 20 million Americans suffer from a substance use disorder. In health class, we all learned that drugs and alcohol are addictive. The Department of Health and Human Services should offer more help to those suffering from a substance use disorder. First, I'll tell you the problems associated with the different types of substance abuse and how many families substance abuse affects daily. Then I will offer a solution to this. First, I will tell you the problems associated with the different types of substance abuse and how many families substance abuse affects daily. There are two main substances that are abused. There are drugs and alcohol. There are a lot of health issues that come with both of them. A major health issue is, according to Amy Peacock, a senior researcher at the National Drug and Alcohol Research Center, and her colleagues from the journal Wiley Online Library on May 10, 2018. Addictive drug, alcohol, and illicit drug use are risk factors for disability and premature death. Alcohol and drugs play a big role in America. You may know of someone who struggles with alcoholism or addiction. With alcoholism comes many liver and kidney problems that can cause premature death. Addictive drugs often get prescribed to someone who may have had a recent surgery or struggles with chronic pain. According to Kathleen Hawing, a specialist in internal medicine, and her colleagues from the journal Ingenta Connect in April 2016, 25% of physicians are not concerned about the misuse of prescription opioids. More, if not all, doctors should be concerned about the misuse of any substance. There are a lot of health issues that come with the misuse of drugs. According to Matthew Ronan, an instructor at Harvard Medical School, and Joshan Herzig, an assistant professor at Harvard Medical School, from the journal Health Affairs, in May 2016, serious infections are a complication of drug abuse. Some of these serious infections include HIV or hepatitis. Doctors should be screening and handing out pamphlets to patients who are misusing a substance. This will help those patients get the help that they need. Families are often impacted very deeply by substance abuse and not in a positive way. Substance abuse is so common in America, according to Catherine Buchholz, a senior data specialist, and her from the journal Statista on November 8, 2019, 46% of Americans have dealt with substance abuse in their families. This is almost half of America's population. Substance abuse can cause a loved one to struggle with mental health issues, cancer, or heart disease. Yet the Department of Health and Human Services still has not offered more help to these Americans suffering. Now that I told you the problems associated with the different types of substance abuse and how many families substance abuse affects daily, I will offer a solution to this. The Department of Health and Human Services should offer more help to those suffering from a substance use disorder. According to Christine Villalobos, a public health analyst, and her colleagues from the journal Rural Health Information Hub, on November 23, 2020, people suffering from a substance use disorder find it difficult to navigate through the complex system. The Department of Health and Human Services needs to make the system easier to navigate through, as it does not need to be complex at all. Someone who is struggling from substance abuse needs to get a referral to even get the help that they need. This person needs to be able to go into a treatment center and admit themselves without having to have a referral. This will promote more substance abusers to have a family member help them get the help that they need, instead of a court or doctor order. Treatment centers are often very costly, and not many can afford to go. According to Jeffrey Juergens, a jurist who graduated from the University of Florida, and David Hampton, an addiction professional from the journal Addiction Center, on November 26, 2021, the average cost for rehab centers is between $12,000 to $60,000 for just 30 days. The price of rehabilitation often deters those struggling. This price needs to be lowered to a more reasonable price. To lower this price, treatment centers can open up a car wash and do a fundraiser, and have the patients far enough into their treatment plan work at it. This way, the people paying for the car wash and donating towards the fundraiser are helping to lower the price of rehab centers. Signs should be put up offering a number out for substance abusers to call so arrangements can be made for them to be picked up and brought to treatment. Today I told you the problems associated with the different types of substance abuse and how many families substance abuse affects daily. Then I offered a solution to this. The Department of Health and Human Services should offer more help to those suffering from substance use disorders. Offering more help to these 20 million Americans will lower this number immensely.